Good evening and welcome, sir, and welcome to this very interesting session of Best Friends Forever. But this is the second in a series. First one we had last Sunday, and for this occasion, you have two very legendary surgeons of India, legendary surgeons and teachers, and very senior members, Dr. Dayanandababu from Trivandrum and Dr. RajGopal Shenoy from Manipal, and it was his birthday yesterday, Dr. Shenoy's birthday, and
Thank you.
on behalf of Learning Channel Surgery, we have great pleasure in wishing you a happy birthday. And this occasion is not an academic discussion which you are very comfortable with. This is slightly different. So we just wanted to know, because see, there are every now and then when I look at either your Facebook or Professor Babu's Facebook, I see your photos together. I often wonder, because you've been together for many years. I just want to start with Dr. Babu saying what attracted you to Dr. Shenoy, or how did Dr. Shenoy get attracted to you?
No, actually, it is an ardent friendship of really mutual respect and admiration. That will sum up everything, because we have got mutual respect, we have got admiration. Both of us we have passion for teaching and also passion for writing. And we meet in many places, especially during conferences, CMEs, and that is how we became friends. So that is the fact.
Dr. Shenoy. Sir, Shenoy, sir, what attracted you to him?
What to say about sir is quite senior to me, and I'll put it as a you are told as friend. I can also add some more words for sir, because I don't mind even calling him as my guide or even a well-wisher, and even you can call him as a senior teacher also, because the basic factor is yes, both of us are teachers, correct? This is how we started with. And once you meet in some forum, if I'm not wrong, some 10-15 years back, sir probably will tell, I think, more details, that we came to know each other, and each teacher has some different way of explaining the things, and also there is a different way of approach to the problem. So, and each state has, in India, in fact, each state has produced excellent teachers. It's not just confined to only few areas. But then our Karnataka place where I am working, and Kerala, we are somehow very nearer, but for one small border related issues. Because once you take a train, you straight land there. So slowly, what happened was that we started meeting in CMEs, liking each other based on the values of the basically student-centered teaching programs, exchange of the ideas, and occasion to meet, and friendly nature obviously is a mandatory. There are many people are there. So, but approach, next is the approach. So as we started liking each other, and slowly the friendship continued. That's all I can say in a nutshell.
Sir, I had a very little time on Madurai when I could catch Professor Dayanandababu and did an interview and asked him about his childhood and his schooling and his college, etc. So, because I would like to hear from both of you once again, and I'll start with Dr. Shenoy as to what made him. How was he as a school student? How was his schooling? Actually, this conversation is supposed to be between two of you, each one asking the other questions rather than my coming in between, because the focus changes, because focus should be on both of you. And what prompted you? I just want to know whether any similarities in your childhood and sort of what inspired you to take up medicine as a career.
Yeah, I think when I joined the medical school, of course, sir has joined much earlier than that. Mine was 77 batch when I joined. There was nothing like a guidelines or something like you scored some marks. You parents told join medicine. I joined medicine. In fact, to tell you very honestly, before the medical seat got sanctioned, week before I got in KREC Suratkal. KREC is nothing but today's actually, it's a, earlier used to call it a regional engineering college. Now it's a National Institute of Technology, quite popular in Karnataka, especially in our area. Anyway, nevertheless, so joining the medicine was, parents told me, you join, so I joined. Of course, there was one more reason. My elder brother had already joined medicine that time. And so I followed him. And of course, he studied in a different college and I studied in a different college. But actually, there was not much of a concept that time in our area that you appear for even entrance examinations. Let me be very honest with you. By the time, already lots of big centers were there, whether it's AIMS or a PGI or a JIPMER or a Vellore, or so many centers were there. I did not even appear for a single entrance examination. Based on my PUC marks, I joined medical college. That's all. That is my beginning. Probably sir will tell, I think, more deep.
Babu sir.
Sir.
I think I have told everything in that interview, chit chat with Dr. Dayanandababu by learning neurosurgery. So I have told the entire story. Of course, I studied in Trivandrum Medical College. I belong to the 1966 batch. So I think we are 11 years apart, junior. Shenoy is 11 years junior. Of course, I joined after pre-degree, not BSc. So I joined at the age of 17 years. That was the minimum age prescribed for the medical admission those days. So I joined in 1966 at the age of 17 years. And of course, that time the admission was based on the marks. So pre-degree marks. Those days, 2/3 of the seats were given for the BSc graduates and 1/3 for the pre-degree. So somehow I got admission. And of course, there was some reason behind which I have told in that interview also. My mother used to remind me that you told me as a small boy that you will join medicine. So that was the stimulus. And of course, I decided to join. And later on, of course, after my BBS, I did PG. So before coming to PG, again, I studied MS also in Trivandrum Medical College. I would like to hear from Shenoy what happened after 77 and MBBS.
Sir, same like what you rightly said. I'm exactly when I joined medicine, I was less than 17 years. To be precise, I was 16 years and 10 months actually speaking, because that time the dates were preponed actually, in the sense because that time the date of birth certificate was not there. So usually they used to tell that actually month is September, but they are put as May. Anyway, leaving apart that, the completion of medicine in a government medical college, Bellary, was actually very reluctantly, even though I was a rank student in the PUC, but then very reluctantly went to Ballari. Those days, I'm just talking about those days. But sir, it's a big surprise, and it became immemorable for me and for my batchmates, and for amount of teaching which was there in that period of, I'm talking about our time, was you can't imagine that, whether it's anatomy or whether it is, of course, surgery. I took up surgery only because of my passionate teachers in that time itself. Sometimes back I had told this, when I was a final year student, I took small batch clinics to the third semesters that time. You know, teachers will take some time to reach the wards. That time a small group of interaction that time, and no PGs that time when I joined. Only PGs came later in Ballari. So there is no repentance for that. Whatever happened was excellent, it was. And once I completed my MBBS, again, sir, I did not appear for any entrance examination. There was no concept or no thinking about entrance. And I got in Kasturba Medical College, Mangalore. It's about 60 kilometers from Manipal. And did my MS in Mangalore between 1983 and 86. There, of course, as I mentioned, all great teachers, you can call them as a very senior professors, including few of them, namely M. Srinivasan, who is there now in Chennai, and of course Professor C.R. Ballal, my another teacher, regularly comes in LGS for clinics, and still at this age, he is of course in Chennai also, and few other teachers also. That's how it is, sir, as far as my MBBS and MS is concerned.
But what is how was the work culture? Were you working all the time in the ward, working very hard? How was that you learned surgery, sort of both theory and practical, so very well compared to say many others?
I will take it first. I think this is during our probably I'll come back to MS only, I suppose. We were practically staying in the hospital itself. There's through the word residency program, and there was no separate duty rooms. It was some kind of a common, some 15-20 people used to stay in front of the casualty rooms, and we learned practical aspects only by staying in the wards. Doesn't mean that we have not got off at all. It's not like that. But vast majority is that you have a direct interaction with the patient. Any emergency comes, first you start talking, first you diagnosing, and then of course the rest of the whatever treatment, investigations. You used to follow the patients for a final part to the CT scan. CT scan had just come in Mangalore around that 85, 86 period, 84, 85. We used to take the patient to the CT scan room there, sit with, because it's all beginning. For everyone, it's beginning. Learn something in, come back, inform, whether it's ultrasound. All these things used to happen. I remember to take the patient for intravenous pyelography. You yourself go, ready, stand there, and see for any complications, see for any anaphylaxis, catheterization, everything. Everything basically stayed maximum time in the hospital. That's what I can say.
So, Babu sir, how was your MS general surgery days?
Maybe more tougher.
No, actually, before joining MS, I was a tutor for about more than 2 years with my MBBS alone. Those days they used to appoint. So I got a PSc in surgery, and I have done most of the emergencies during that tutorship with MBBS. Most of the cuttings, most of the emergencies. I was at Kottayam Medical College. We used to get lot of stab injuries, penetrating chest injuries, abdominal injuries. I still vividly remember I was on duty. One patient came to casualty with a stab injury, penetrating injury abdomen. The entire intestines were lying outside. Those days, no PGs were there. So I have taken the patient to theater, only house surgeons, and that house surgeon, duty house surgeon, will go to the blood bank for grouping, cross matching, everything he will do. Those days, the house surgeons were the
Yes,
backbone
yes.
of our department. And then he himself will bleed and bring 2 bottles or 3 bottles to the theater, and then he will assist the operation also. So I still remember one of the house surgeons who is now professor of medicine in the Ludhiana, St. John's, Ludhiana, and he was washing the intestines in a wash basin as though he is washing clothes because the intestines were full of dust. And then you wait for another stab injury. So those days, stab injuries were very common. So the entire night I'll be operating. So I have learned most of the surgeries by doing this emergency while on duty during this tutorship. And also as a house surgeon, I was lucky enough to do a gastrojejunostomy. One of our assistant professors those days is still practicing surgery in Kim's hospital here in Trivandrum, Dr. K.N. Vijayan. So he made me do one gastrojejunostomy because then unit chief, she is no more, Elizabeth Leela John, she said that the PGs are useless. They don't come to the ward. They don't do any work. They just cut and leave the ward. Therefore, the house surgeons are doing work. You make him do gastrojejunostomy. So as house surgeon, I could do a gastrojejunostomy. Then as tutor, I could do most of the emergencies. So when I joined MS, so I was competent enough to do most of the routine. Of course, I have learned many things from during my PG days, especially my teachers. The HOD was Professor Balsam. He was a clinician par excellence. And also, while I was tutor at Kottayam, Professor KJ Jacob, he was also a clinician par excellence. Those days, the Professor Balsalam, by just palpating the abdomen, he used to make a diagnosis of splenic cyst. Once a patient was referred from medical side, and then he palpated the abdomen, then asked me, what is your diagnosis? I was not having any diagnosis. There was a lump in the left hypochondrium. I said it could be a spleen. But he said, doctor, I think this is a splenic cyst. That was the clinical excellence. And it was nothing but a splenic cyst at laparotomy. One more instance, I will say, I was washing during the theater for assisting him for a breast lump. And while washing, Professor Balsalam asked me, what is your diagnosis? I said, maybe a benign breast lump, maybe fibroadenoma or something. He said, no, doctor, I feel it is a lipoma of the breast. And it was lipoma. So the good role model clinical teachers and surgeons modeled our life or surgical career, I should say.
Now,
So just to add on to what I said, the internship time in a government college definitely gave few chances, like appendicectomy with assistance, of course, and lymph node biopsy, circumcision, etc. And I believe that our generation people, most of us learned, I think, during emergencies. That is something, you know, that that's how we became probably whether it's a perforated duodenal ulcer, one common surgery, and of course obstructed hernias, intestinal obstructions, and as sir has put it, GJ vagotomy. That was something government Bellary used to have lots of cases of GJ vagotomy. Of course, we have seen an assistant. I have not done that there, but of course, as continued later in Venlock Hospital, that is attached to the Kasturba Medical College, Mangalore. Yes, the major part of the surgical emergencies and electives were done. And later, of course, joining an institution, it adds to your other skills.
Sir,
But our teachers, again, coming back to what sir said, they had that excellent clinical acumen. Obviously, sir, the reason maybe they were, that generation had that number one is experience, second one is a knowledge, and third one, there were no investigations. So it's like that you buy a exclusion or a process of thinking, and they would have probably come to the diagnosis what sir has told. Yes.
Sir, Babu sir is got, because there's nobody got a lot of surgical chances, and even before MS general surgery is done a lot of. How are your surgical chances?
Mine?
Yes.
Yeah, no, I had, yes, as I told you, I'm actually one generation actually difference is there. So I had a decent chances, I can say. Basically, one thing is that surgical steps are important, and surgical indications are important, and some basic principles. Nicely doing a hernia surgery, clean surgery, starting from the incision till that time. I believe that when you want to learn the basic skills of incision, dissection, anastomosis, that these are some few fundamental things. If you know a proper anastomosis, whether it's intestinal, yes, then colonic, then of course the gastrojejunostomy, a different kind of a thing. I admit that I had not done thyroid surgery at all when I was a postgraduate. I should admit that. But emergencies we did a lot. GJ vagotomy, of course, lumbar sympathectomy, we should not forget that time, and damaging some veins and some bleeding there, packing there, all those things are always there. Chances were there in addition to the teaching. I should admit, might not have got that much. So stab injury and this pellet injuries, pellets. For the wild boar, they fire these pellets, and this actually multiple shots of these small pellets. We had a real some of those cases in Mangalore. Otherwise, yes, may not be as much like as Babu sir said. That much experience.
Because but the reason why I asked this is these days, when the students finish MS general surgery, I mean, we are not very sure that they are fit enough to be consultants. I mean, that Babu sir is already a consultant even before joining MS general surgery. So I just wanted to know from you that do you think that you are fit enough to be a consultant? You didn't require any extra training before you become a consultant, or other steps? Shenoy sir.
Me, sir. At the completion of my MS, two things happened. Number one, I did go to Medical Trust Hospital on one day, and in fact put an application and came. The reason is, after getting my MS in Mangalore, the standard discussion was either you work in municipal hospitals in Mumbai. I'm just telling openly, many of people went to Mumbai, or work in mission hospitals in Kerala. This is the straightforward two things. Advice always told to the postgraduate, because you may be remembering of one Dr. Jairam Shenoy, my senior. He always talks about P.T. Thomas. I think I forgot where he worked in Kerala, big hospital. After his MS from in Mangalore. So I went to Medical Trust Hospital, put an application, and came back.
In
but
Kochi?
Kochi, yes.
Okay. Yeah.
That was one of the hospitals it was mentioned. came back, but somehow there was no vacancy or something like that. And then for a short period, I applied Manipal, in fact, 86 July or some that time. There was no vacancy. And for a small period, I did private practice. It was not that I wanted to do it. It was not that I was not really confident. Let me put it openly in front of you. But then that was given to me by my teacher, who said, you go there. And he also suggested there are one or two other seniors who are established. You can take their help and do. That's how it is. So it was very short period. And then, of course, joined Manipal within 3 months and stuck here. Yes.
Babu sir, now you didn't have any such ideas of, because Kerala itself had so many chances to. How was it? What did you do soon after MS General Surgery?
Of course, I joined back to the general surgery department. I took leave for my studies. And actually, when I joined as a tutor itself, my boss at that time, Professor KJ Jacob, he told me that, are you willing to spend 5 years after your PG with somebody as assistants in the department or somewhere? Otherwise, you will not become a good surgeon. So it is one of the requirements that one should be able to work under a senior person for 5 years. This is what he told me. If you are not willing for that, don't join surgery. You better join some other subject. So that was the first and the only criteria he told me when I joined initially with my MBBS in the Department of Surgery. Of course, again, before joining MS itself, I was posted to neurosurgery for about 6 to 8 months. Exact period, I don't know. Actually, at that time, the neurosurgery professor told me that, why don't you take up neurosurgery? Because next, within a few months, the interview will come. You apply for that. I will be there in the interview board. I will see that you are getting good rank. So those days, it was a pre-CT, nothing was there. All based on carotid angiogram. That was the only investigation available. And whenever a patient is admitted, we will take the patient for carotid angiogram, and 1/3 of the patients will die after the angiogram, or at least some 20%. So I was fed up with the mortality in the neurosurgery ward. Actually, so I said, sir, I don't need neurosurgery. As long as I am with you, I am comfortable, I will do all the works. So I was very sincere. That is why he said, you join neurosurgery. And similarly, I was posted to thoracic surgery also. So thoracic surgery, again, I was there for more than 4 or 5 months. So I used to assist him, and even thoracotomy I could do. In fact, when I joined Saudi Arabia for a period of, I went to Saudi Arabia after, of course, qualifying after maybe 10 years of my MS. I joined Saudi Arabia for, and the first emergency I did in that hospital was an emergency thoracotomy, which the department criticized me like anything. Yeah, because no surgeon has done thoracotomy there for a bullet injury, which was sitting near the descending aorta. So I have done so many thoracotomies. So I removed the bullets. But the surgery chief, who was an Indian, and he said that there is no need for thoracotomy. You have done an unnecessary thoracotomy. Just tube thoracostomy would have been enough, like that. Anyway, that patient was a Sudani patient in Saudi Arabia. So I have done uh, thoracic surgery and neurosurgery even before my MS. So that is the story.
Yeah, effectively, it's like a very complete surgical training. That 5 year, what you
Yeah,
Keith was
sure.
saying that.
Right.
Yes, sir. That's how it is. Because after I joined Manipal, we were lucky, sir. N. Rajan was my HOD, sir. I reported to N. Rajan. N. Rajan had just come from Trivandrum. So he is a surgical gastroenterologist. So I reported to N. Rajan in 1986, December 1st. So in fact, esophagogastrectomies, Ivor Lewis, and even Sugivara Futagawa operations, and shunt surgery, Whipple's pancreatic duodenectomy, all that was from 86 to 91. Maximum GI surgery work in Manipal took place during that period, when Rajan was the head of the Department of Surgery, under whom, of course, I was the junior most faculty. Then slowly, there was a rotational postings. So the next level faculty took over that, and of course we got training under that. So that actually completed, as what Professor Babu has told, is that even with the MS general surgery, 2-3 years is not enough. It's not about that. And today any faculty who joins, yes, he would like to do MCH. There's no issue about that. I always tell, in case if you do not get, at least stay 5 years and get yourself some focus somewhere, whether it's whatever you want to do. It's not achieving MCH or something, but in this 5 years, general surgery, with 5 years of training, with endoscopy, and definitely laparoscopic procedures of whatever with your focus, one can do well. And trauma, as the sir had put it, one of the maximum satisfactions which at least I get is I should put it that way, is from trauma, after surgery on the trauma patients. And because the results are really good, especially for definitely for selected patients. So many instance I can quote of the story of in a nutshell, to say quickly, a load tons of onion. Lorry was coming from Lathur, Maharashtra to our area. 15 kilometers away from our hospital, the whole lorry got tilted. The loads of those bags of onion fell on not a driver, the other fellow. Driver died. The conductor, not conductor, the cleaner or whoever it is. So nobody, police brought this person to our hospital. Massive liver injury. No money, because ours is a private institution. No attenders, no consent. But as sir had put it, I was just joined that time. We ran for blood, then interns, everyone. And we managed that patient. He walked home with even an intercostal tube, everything. Trauma is, I think, maximum satisfaction. But I think 5 years is required, sir.
Yeah, but Shenoy sir, why didn't you join government service?
Me. Interestingly, I should admit the fact that when I got a government seat, we had signed an agreement with the government. I'm talking in 77 itself, agreement. If I am called, you should serve the government that time. Government has never called. First, government has never called. And we are in an area, what is called as original South Canara district. Or you can, today it is now bifurcated South Canara and Udupi district. It's somehow that government, that culture was relatively less. Let me put it honestly in front of you. Because this area is developed in a little different way. All the private bankings, you know, the leading banks of the country, Canara Bank, Syndicate Bank, Vijaya Bank, Corporation Bank, Karnataka Bank, all from our place, within 60 kilometers distance. Private banks, NIT. Then, of course, 2 hospitals like Kasturba Medical Manipal is a private, and Mangalore is a private college, but utilizing the government. That never stuck to me that I should apply the government job, but I was happy. I joined Manipal, and I was looked after so well by the department. It all depends upon how you will be looked after in your department by your professors or HOD or seniors. They looked after me so well. So I continue.
No, actually, I want to ask Dr. Babu and you this question, sir. How can we impress the hospital administration, the bosses, the everybody saying, okay, this Dr. Rajgopal Shenoy is very much needed for the hospital. You know, we can't let him go. How do you, what exactly you do to impress everyone, the owners of the hospital, the dean, the director, the HOD? I mean, what is that you should do or what is that you should not do?
I'll put it this way, sir. Now I become senior, so I'll put it that what I can expect from a person who joins. I think first I will talk about that. One is time, sir. Time. Whatever said and done. It's not that 8 means you come at 8:1 or 8:2 is okay, 8:5, but what we call as some kind of a discipline. Second thing is, it should be a little bit of a multitasking capacity everybody should have. It's not that I do only this and I go. Sometimes there will be one batch of some students would have gone, some students would have come. See, I have taken just one class. It's not the idea like that. See, there's one more batch has come. You may have to engage them. And next comes about the surgical things. That yeah, obviously skills are the ultimate for any profession, especially surgical profession. Teaching is one part of it. If you are able to teach the students well, obviously there's nothing like that. Students come and report to always the chief, sir, he has not taken class well, sir. He has taken very good. Now next comes the surgical skills. You are done a surgery. We expect that whoever who has done the surgery should look after the patient well. It's not that I am not on rounds this week, my colleague is on rounds. It's fine that the other colleague will do the rounds, but you should show your interest because you have done the case. I am there, yes, you have done the case. That is about number 2. Today's expectations are also about the research papers today. Let me be very honest with you. During neither my MS time nor in the initial 5, 7, 8 years, there was not much of emphasis on papers. Not much of emphasis. We were a little slow in that direction. And of course, last but not the least is yes, administrators. I'm coming to our hospital. SIRS is a different situation. Ours is a private institution. Obviously, we have to have a real balance now because one side patient should not be neglected. At the same time, the college also expects that you have to take good clinics, good case discussions with the students. And this is where we have to have a balance. And yes, sometimes we do go wrong, but somewhere we have to have a balance. I don't think you can satisfy 100%, sir, at this juncture.
So, but from your talk, I understand that you have to be punctual, you have to be good in surgical craft, and you should be a good teacher. That you should teach juniors, and of course, obviously, you are a honest and you are a very reliable, trustworthy person.
Yes.
I mean, these are things the seniors or the administrators. So, how about you, sir, Babu sir? How was that people started liking you for what?
No, I think I was in government sector, and government sector, what you need is, of course, discipline, punctuality, work culture, duty. You should be conscientious regarding your duty. All those things are important. And of course, academics. Whereas I feel I was in private also. In private, it is the income generation is very important for them. And second is loyalty. Loyalty and income generation are more important. I feel that even if you are not focusing or not a good academy, they are more bothered about income generation and loyalty. Whereas in government, it is totally different. There is no question of income generation there. And of course, as I was the state president of the Kerala Government Medical College Teachers Association. So we will fight with the administrators also and the bosses also. So as uh, it's something like trade union activity. So it was also there, but still, even though we fight with the principal or the dean, they used to like us because they know that we are inside, we are very good and we are required for the institution. We will join for other activities like the teacher training program or the other scientific programs, medical education programs organized by the institution, and then the college union activities, the supporting the students, mentorship programs. So those things, everybody will not come forward for taking up those posts. So that is also there, the extracurricular activities of the students and the as staff also we used to do staff nights and entertainment program by the faculty for the students we used to arrange. So those things are also there. So private, it is totally different. I feel it is mainly loyalty and income generation.
But Shenoy sir, you are a highly extracurricular. I mean,
No,
you are on the stage for every program, I'm sure. You are in
no,
singing,
no,
debating, sports.
somehow
And
I should admit that my primary schooling and high school also played a role in this. See, what I would like to mention at this stage is what kind of a talent helps, what kind of a student or a faculty at what stage of career is difficult to say now. As a primary school, my parents and they encouraged us to say singing, tabla, harmonium playing, debates, competitions, chess, all that. So many things happened. So these things are some kind of a thing for a overall development. You get involved in addition to your usual hospital work is always there. So once in a while, when these students functions take place, as Babu sir has put it, one plus point about all the institutions is something like strong student unions, not for making any noise, but for the cultural activities and academic activities. Like we have a cutting edge in our institution. They have different kind of activities going on in the campus, and obviously, if you have one of those, you should be basically student friendly. That doesn't mean that you should not scold them. Not like that. That doesn't mean like that. Some kind of a mentorship for academics as well as non-academic things also is required. Even in the campus, lively activities should take place so that it is for the overall development of an individual. Because later when he goes to whether it's a practice or hospital, nobody is bothered whether you are triple FRCS or single FRCS or MCH. If you behave badly with the patient, you know what is happening. So that is a ultimately important thing now for the future generation of students. I see a question there that good teachers are slowly vanishing from medical teaching institution, and what is that holy relationship is somehow getting disturbed. What you suggest? This is what, see, it's very difficult question to answer, because it's a both should have that kind of a attitude or a passion. If I like teaching, I will join, and the next important thing is the student, and student also should behave in a responsible way, especially postgraduates. So if their intention is come here only to do surgery and go away, if their intention is only not to follow some kind of an ethics, not to, rather misbehaving and all, and because of different kind of a okay, we'll put it that way, the whole system. So there are some differences, there are some problems, but by and large, what I have seen is that if a teacher does his job well at all levels, I think the teacher-student relationship is going to stay. That is what I feel so. Sir, Babu sir can answer that.
I think he
You
has
know,
answered on whether the tribe is vanishing. Dr. Dayanand Nuli has come up there, where he can
This
comment.
question was asked by Dr. Dayanand Nuli. He was the past chairman of Karnataka State. So he asked
Babu
that
sir,
question.
your
I
response.
think it's a question of attitude.
Yes, sir.
One Harvard study revealed that success is 85% of the time is due to attitude, and the role of knowledge is only 15%. So that is why it is said that attitude will decide the altitude. This is applicable for both students and faculty. We have got so many, if somebody says, I cannot do it, it has got two meanings. First is, I don't know, therefore I cannot do it.
Correct.
The second is that I know, but I am not willing to do. This,
Yes.
the first one is easy to tackle. You give some training for a person who doesn't know, he will do it. The second one, I know, but I cannot do, means it's a question of attitude. So this attitude, without a good attitude, no teacher will be a good teacher. No father will be a good father. No parent will be a good parent. So for all posts, irrespective of the position, whether doctor, medical or non-medical, attitude is the most important thing. So 85% the time, the attitude will decide the future and success. So I always say attitude equivalent to success. So success is decided by your attitude. That is professional, educational, everywhere, teaching, everywhere. Attitude is the most important thing. Therefore, I say that this is the most important word in the English language, attitude.
Sir,
So,
Can
if
I,
yes, sir.
yeah.
since Babu sir has told attitude is so most important, and since this is an informal talk, and at least for postgraduates or faculty, Sir Jamshedji Tata, after the independence, when he was addressing engineers, he told, if the country has to grow, the most important thing we require is attitude. And he says one important thing, such a beautiful word in English, to give an alphabet A, you give 1. And calculate A, T, T, I, T, U, D, E. This is what I always tell my students, UG and PG. My class start like that. You add that A is 1, add all the T, T, I, T, U, D, it comes to 100. It comes to 100%. So Tata said, if you have a good attitude, country can grow. I think they are doing it well. We can also do it, sir. It is rightly depends upon the individual, whether it's a faculty or a teacher. But the issue that comes here is that, yes, money is required. The finance is required today because you have to live a dignified, whatever life you can call it as. So if somebody can balance, yes, Dr. Dayanand Noli wants to tell something, sir, you can always
Yes,
tell.
yes.
But the relationship between the teacher and student can be definitely holy if both decide. Yes, sir.
Hey, my question was regarding the examinations also, sir. When we have 4 examiners of 2 are external, 2 are internal, and sometime it's a very tricky situation wherein the student on that day he's not doing well. In that way, internal examiners know that he is a sincere boy, he is doing very well, but unfortunately on day of the examination, in that particular case, he might not be doing well. Somehow the examinations, there will be some egoistic points between the examiners. Sometimes the student is victimized. How to come out of that, sir? Because some examiners are very dominant examiners. They will stick on to their, even if they are wrong, they will stick on to their findings. Unnecessarily the student is jeopardized there. So both of you are the senior most examiners. How you will give some message to the examiners so that the justice should be given to good students?
Sir, Babu sir, please take it first, sir. You are senior most.
No,
Yes.
I think that era is over, where the student is failing for for not getting some clinical science. That is over now. I don't know. At least in our part, nobody is failing for the want of or some if some clinical findings are missing. That era is over. If even if the student is giving a wrong answer, okay, let us discuss that part. That is how nowadays we are conducting exam. So the examination is very liberal, I will say, both UG and PG examination. I will say one example. There was on patients with a carcinoma stomach, epigastric and right hypochondrial mass. The student said that it is the liver. So then the question was, okay, uh, if it is liver, what is your diagnosis? He said, okay, it is hepatoma. And so that is how the uh, discussion. Okay, then the examiner said, okay, it is only liver abscess. What do you do for that? And then the candidate said, I will do hepatectomy for liver abscess. Then absolutely the external examiner said, I think this candidate should fail because for liver abscess, he is suggesting hepatectomy. So I think uh, the clinical examination nowadays is very liberal. That is what I feel. And nobody will fail as in our period. In our period, if a candidate is not getting on supraclavicular node or some node somewhere, then of course, those days the student used to fail. And the result, MS result, 8 candidates will appear one day, out of which only 1 or 2 used to pass. Nowadays, 8 will appear and all the 8 will maximum 1 casualty. No, I'm not joking. So this is the situation now. 107 candidates appeared in the Health University, Kerala University of Health Sciences here, and 106 passed, only 1 failure. So something like that figure. So what is there in the clinical exam? And now everything is decided by the theory exam, which is based on a centralized valuation. So if the candidate is passing the theory, he will pass. So the clinical examiners, our surgical examiners are nowadays not bothered much about the clinical findings. I feel that they themselves will not see the cases properly, assess the cases properly. And olden days, the examiners, 4 of them will see individually. They used to write down the findings, and then they used to have a discussion. And finally, they will say, if the candidate is telling like this, we should give a pass. That is not happening nowadays. Everything is taken very casually. That is what I feel.
Sir, I think we
So
have deviated.
what I would like to say is that, sir, there is nothing like a last word nowadays in a conference or a CME or a group of discussion. It was there earlier. Not to mention any name. Somebody says, this is my diagnosis, then everybody will keep quiet. That is what is called last word. Something like that also was there in the examination system, because he's too senior, all used to keep quiet. But sir, in whatever I have seen in last few years, that kind of things are not happening. But we don't want to, because the system differs from each place to place, and examiners, there will be some deficiencies. I'm not trying to say there is it's not a perfect system, but by and large, as Babu sir had put it, it is fair, I suppose. And number 2, most of them are passing now. That is also there. And number 3, there is nothing like I want to fail this candidate. That kind of a saying nowadays is rare, sir. I will put it that way.
Sir, I think we have deviated slightly from our conversation. So I'll come back to you. You are mentioning money sometime. Many postgraduates take up surgery because surgeons make more money than others. Let me finish, sir. Now, if say, for example, if you're in a rural practice, you have a farmhouse, a few bungalows, a Mercedes, and this and that. Do you miss any of those at this point of time? Do you think money should be a crime? Why didn't you go into a private practice? And I want both of you to answer those questions.
Sir, what I meant to say is that money is definitely required because looking at the situation of the cost of living, even for a surgeon, it is not that easy nowadays to establish himself within 1 or 2 or 3 or 4. Even if he goes to rural place, or even if he goes to a place where surgeon is not there, also is difficult. So looking at that situation, I only say that he should have a balanced approach in a training period. What I said was, initially we said no, the 3 to 5 years of time. If he gets MCH, it's a different issue. If he doesn't get an MCH in a medical college, if he has to work for 3 to 5 years, has to have some kind of an experience, and then he has to decide, sir, his pathway. I have not got MCH, doesn't matter. As I told, this is the place I'm going to do. And yes, I need to earn some money for my family. Yes, if husband and wife is working, that is adds to the finance little better, definitely, than a one person earning. Because obviously, next generation children and other expectations are there. So what it was, the expectation 25 years back and now is phenomenal difference is there. That's the exact reason why a teacher, when I say whether it's a high school teacher or a primary school teacher or a doctor for that matter, everyone requires money to support himself and family.
So do you never regretted not going to private practice?
Me?
No.
Never.
Babu, sir.
No, actually, what I feel is two things are there. Money is required. Without money, nobody can survive. So money is important. At the same time, ethics is also there.
Yes.
Balance between ethics and money. Say, I had difficulty in surviving actually in my younger days as assistant professor. As when I joined the lecturer post, the basic salary was 325 rupees. Very difficult to even own a car. And so therefore we used to travel by two-wheeler or sometimes even by buses. So very, very, very difficult time I had. My difficulty in money was over only when I finished or joined Saudi Arabia and finished my 5-year service there. So whatever money I made was from Saudi Arabia and not by government money. You cannot make any money. Again, so I can definitely tell the youngsters that money is important, but
Yes.
remember that ethics is very, very important. I have read a story in one of the colorectal surgery Western books that there is something called autopsy under anesthesia, AUA. This is the heading given in one of the chapters, colorectal surgery. Meaning, a patient with multi-system trauma, brain death, will come to the private hospital. The surgeon will take him to OR and do operation. And then the patient will be in ventilator. This is what the author is describing as autopsy under anesthesia. Such things should not happen. Maybe he is exaggerating. The author is exaggerating, but that should not happen. So I always say that what is ethics? Very, very, very important. Ethics is very simple. Whenever you decide for something, intervention, surgery, or even any intervention, you just think, will I do the same procedure for my father, mother, or for my brother, sister, or my son, daughter? If your answer is yes, then it is ethical. You ask yourself, will I do the same procedure for the near and dear ones? That is ethical. If your answer for that is no, I don't know. I don't do this for my father, mother, or for my brother, sister. Then it is unethical. It's very, very simple.
Actually, Dr. Shenoy sir wanted it to finish off by 9 o'clock, but I'll just take a few minutes, sir. I just want Dr. Srinivasan and Dr. Ishwar to have a question each if they have any to these giants. Dr. Srinivasan?
I've got a few PowerPoint projections.
Yeah, yes, sir. If you can start off your projection now, then I'll have some for a few slides for that, because effectively that will down memory lane. Yeah, you can start sharing. Now, we can talk for hours, as a matter of fact.
Yes. Sometimes later, I think after some time, maybe.
Unni?
So Babu sir has learned it very quickly. Because earlier he said one boy used to come and help
Necessity is mother
Necessity.
of invention. Thank you, sir, for this slide.
You can make it full screen, sir. Full screen.
Oh, wait a minute. Wait a minute. Da. Unni.
So just double click on that.
Da. Is comment and 1 minute. Hold on. That is on the full screen actually. Huh. Under full screen.
Full screen, yeah. Now, at the lowermost extreme, yeah, that's right. Slideshow. Next one.
Right. Thank you. Right. So I think senior most, one of the senior most professors, Dr. Satyavan from Madurai Medical College, and Srinivasan, of course, is very young. So we always meet at Madurai for the Madurai CME. Anything more to Dr. RajGopal Shenoy when you see this picture?
Nothing, sir. I met first Professor Satyavan in Bangalore Medical College, one of the CMEs about more than 10-15 years back. After that, I met him in Madurai, and every time he will see to that he will, even if he does not meet in the conference hall, he will come to your room or accommodation area and he will talk to me and go, sir. So I have high regards on Satyavan. Needless to say, yes, Professor Dayanandababu, and this is one very important picture. So,
This was taken during our Bhubaneswar conference. Between me and Shenoy, you can see Shishurda, the statue of Shishurda there. This is, I think, one of the Kerala CMEs. It is Kerala CMEs.
Dr. Patta, sir,
Rajan
I would like to tell that Dr. Dayanandababu, Dr. Rajan, and there are many in Kerala. I became close because of one link among all of us. That is Dr. Srijayan. He's actually my link. Because first time when I went to Calicut as examiner, he was they call, I think, as registrar, something like that. It's more than some 15 to 16 years back story. So from there, I slowly started developing contacts, and this is how it happened. Yes. Sir, this was in that the Tiruvella. No, where is that?
This was a Shornur conference.
Shornur. Yes.
When Radhakrishnan came to Trivandrum.
It was my honor that you come to listen to what I spoke, sir. And it was said
Again, in Trivandrum only. Of course, Baiju Senadipan is known to, I think, the entire South or even North. Baiju will go and operate in All India institutes, in JIPMER, everywhere he will go.
Everywhere, yeah, literally.
This is a nice photo.
Yes, yes.
I'm the central figure between
Where
the
was where was
president and Shenoy.
where was this photos? This picture, sir?
This
Taken?
was, I think, taken at Madurai, or after CME went for a dinner. I think it is Madurai only. I'm not exactly remembering, but he was at that time president-elect. Very nice photo. Again, this is Madurai CME.
Madurai.
You can see H. Ramesh on the right side of Shenoy. I don't know the name of the person. He's a GI surgeon, I think. H. Ramesh is a very famous gastrosurgeon. Sir, you remember this photo? Shenoy, sir?
This is in Madurai only, I think. No.
It's only Madurai only.
Sir, he's from Chidambaram, no?
Chidambaram. Yeah. Chidambaram. Madurai only. So this is from where? You remember?
Of course, I can see Dr. Balaji Singh there.
Balaji Singh is there.
Can't recollect where.
Madhumurali
I
is
think this
there.
is
National.
national conference, and I think myself and Balaji Singh judging one of the short papers there. That is oral presentation. So this again, I think, I don't know from where. Radhakrishnan, you remember?
I don't know, sir.
This is in Manipal. We can see
Copy
there.
of my book to Shenoy.
Manipal CME, Dr.
Manipal,
Dayanandababu
it is written Manipal.
regularly is an invited faculty, and this is, I think, just one year, 2018.
No, 2018, I think.
18 or 19? Yeah, just before this. This is a PT.
This is the Believers Church Medical College. There was a CME, and Shenoy sir was there. That's the photo from Believers Church Medical College.
This is in Calicut CME 2014 or 15. I remember that time this entire group of people, including, of course, Sri Jain, Dr. SRB, Alfred Augustine, the present additional dean in KMC Mangalore, Dr. Siddesh, so many are there. Dr. Joji, correct, no, sir?
Yeah.
Gopi,
And Gopi on the right extreme.
Gopi and Alex, correct?
Alex, right.
So now I know them, sir. Every one of them. Most of them I know their names. Yes. Yeah, this is my book. I gave it to sir in our conference, sir. Where was this? In a conference, I think. I don't know where I gave.
One of the conferences you gave this book to me.
Sir, in Madurai, sir, I took the photo. In Madurai. In Madurai, she was eating. I was having a food in my mouth, so I couldn't speak, sir. It was in Madurai.
Yeah, this is in last time CME in Manipal, sir. You can see also Dr. Ashok Godhi, another senior, very senior man from like Dayanandababu, only contemporary, you can call it, from Belagaon. Then our Vice Chancellor there, Dr. Vinod Bhatt, and entire team. Dr. Guru Shantappa is there, Gabriel, Srinivas Pai, Ellen Moore, SR Bhatt, Stanley Matthew. This is Manipal CME, sir.
Oh. Yeah, your CME and all your dignitaries are there. I think this is Calicut or Tiruvalla or somewhere. Sir?
Sir, this last person is he Cherian Matthew?
Yeah, Cherian Matthew, right extreme.
He's my classmate in Ballari Medical College MBBS. So I think it was the picture, I'm not sure where it was taken.
This is, of course, the third edition of Clinical Surgery Pearls released during ASICON at Jaipur 2017. I'm standing in front of the JP office. These two pictures came in between, were transferred and... Sir?
So I just want to say, Dr. Radhakrishnan, that sir is a senior person also, but wherever we meet in conferences, whether it's a Kerala or CMC Vellore, I have photographs of that even Mukambika Medical College in Kulashekar, Kulashekar, Vellore, of course, anywhere. Sir makes a point to see that both of us will come, both of us sit together, and also we'll be almost till program is over, we are together. That's
we definitely see that we spend some private time talking about something. This is Gokulam conference.
Yes, Gokulam.
Yes. Right.
Trivandrum. Yes.
Trivandrum.
Correct.
This is, again is maybe Kerala conference only.
PK Das, sir.
PK Das.
Evening, we had a riverside resort.
Very nice. Yeah, correct.
Stanley Johns.
Stanley is there. Right.
Correct.
This is sort of our convocation, of course. Again, picture came in between. You can see Marudha Pandey. This is the MCH examination for endocrine surgery. So I used to go there early as MCH examiner at MMC. So this is MMC. Sir, you comment?
I think this is Vellore, no sir? Vellore.
EFC Vellore.
Yeah. Dr. Inian is there. Inian Samarasan is there. Manohar is there. Is now
Manohar is there, yeah. And Velusamy is there. And at that time, I think your daughter was studying there also.
Then it may be in the last either 2017 or 18, I think.
17, maybe 17.
17 or 18.
The president of the Royal College of Surgeons, Edinburgh, I'm handing over a copy of my book to the president of the Royal College of Surgeons, Edinburgh. Only.
Madurai, of course.
I think this is Madurai. Madurai conference.
I think
last year. This is
again Madurai, sir. Again Madurai, sir. Dr. Vijay Kumar was there that time. Marudha Pandyan is there.
Marudha Pandyan is there, right? This is your conference, sir. Manipal. Yeah.
This is.
I think it is the hotel. Value View Hotel.
Value Hotel before the dinner, I think, night dinner, faculty dinner, all are there.
Before faculty dinner, all the faculty members are there. Very nice photo. Any idea, sir?
Obviously, no, sir. Except you, I can't recognize any one of them.
Martin Walsh, another famous keyhole surgeon, the retroperitoneal laparoscopic adrenalectomy person, Martin Walsh, from Germany. I think that is the end. So I could collect 30. More are there. I could go back only up to 2017. I think more of the pictures together are there with me.
Sir, I think most of it will be repetition, just to tell that
it's still worth repeating, sir.
My hobby of songs, what I said, So in Kerala, wherever I go, they will pull me for a song, and invariably, Dr. Dayanandababu also joins in singing some Malayalam songs. I
think it is a common passion. Music
So,
is common between us, isn't
so
it? Uh,
You're
I
wearing bell
don't think
bottoms, sir.
I don't think anybody. I know this is 77 bell bottom with that broad belt and etc. So this was the song which I sang in those days. Yeah, we can change. Yeah, this was I was the chess player there in the medical college. This is one of my hobby. I don't have other extra sports hobby. This is the only one hobby. That time the osteology was given so much importance. There used to be a separate batch. Every week there were many classes on osteology, and that's how we learned the basic anatomy really well, because today it is so difficult to find this kind of a actual culture. Yes. Yeah, this was some of the extracurricular you were talking. Debate competitions in Canada. My friend and I used to participate. Yes. So these are things which helped us basically to come up, and as also as a teacher. The stage fear, the so-called the stage fear was not there from the time from beginning. That's why first one was joined, and this is when I completed 60 years just yesterday. So photograph was 3 months old, and the lower, yeah, these are some of my students came home, and whom I taught. Now their children are reading my books, and they were carrying just my, this is my library in the house. They were carrying the books and just wanted to post a photograph with me. All their children are now medical students. Yeah, this is my OPD, the usual. Sometimes you can see the file there. Yes. Yeah, this is a unit as a whole, the my unit. This was of course last year, and yes, these are some lot of photographs common. This is in Cochin, where Dr. Santosh John Abraham conducted the CME program.
right.
I think same picture. You can same hall. I think you may be recollecting 2011 or 12. Yeah, Dr. Suresh Chandra Hari was, I think, the president that time. Yes,
President. Right.
Ellen Mohan is there. St. John's that time he came from St. John's. Yeah, 2013. This is the picture which we have seen already. This is maybe in Calicut, I think, sir. This Dr. Siddesh had come as a speaker also. This you have shown, or Tiruvella,
Yeah.
2016.
Yeah.
Next, this is Vellore. Dr. Sitaram is there in that. Yes,
Sitaram is there.
correct. Again, Vellore, because I think 2-3 years I went there. Last year I could not go because of my daughter's actual marriage time was there. And Bhuvaneshwar Con. This was that smart, they called Mukambika academic program. It was for undergraduates, and I like the whole concept of the UGs. They arranged Dr. Mukambika herself. She arranged a lot of people, and her husband, of course, including me, including Dr. Dayanandababu, including my classmates.
I think Dr. Shenoy, at that time, you started from Manipal, then you came down to Calicut. I was there at Calicut. Then we moved together. We reached Mugambika, and from there we went to Vellore, CMC Vellore.
Yes, sir. That was the time. 3 of us moved, correct. I remember.
Yeah.
From Mukambika, next day we went to Vellore, correct. Yes. Yeah, this was the same Mukambika, Kulshekar Mukambika. Somewhere one falls was there. I don't know the name.
It is waterfalls there, right.
Yes, yes. This we have seen at Madurai only. Madurai. This is Manipal 2016. Dr. Pangi is from Belgaum, other than sir and myself. This is in Manipal. Sir, I met, I think, first time in Manipal. That's what Dr. Babu sir told me. Correct?
Yeah, as early as maybe 2000, I think at that time,
yeah.
You were associate professor, something like that.
Correct.
Right.
Madurai, yes, we have seen this. Madurai again. This was 2018 in Manipal. This is just before the pandemic. I think
2019 February.
Yeah. Yeah, Dr. Srijan is there. Srinivasan is there. I have edited this because table is not seen there.
Okay.
It was during the dinner time.
Right, right.
Edited a little bit. Yeah, this was the.
Sir, I think no two faculty would have taken so many pictures, sir.
No, now I
Together.
think because this that's what I told other day in the while giving a talk. Everyone has a mobile camera, and the quality of the mobile is so good. Document the clinical findings. Document the small video steps of whatever. Maintain the privacy, no doubt about it. Privacy of the patient and other things. But it's a long run. It will help for everyone, for that matter. Yeah. So that was, I think, with Srijayan, we attended a conference, I think, in Wayanad. It was, I think, IMSA, sir. I think so. I may be wrong.
Yeah.
Because he's actually my link to entire Kerala is Dr. Srijayan.
Okay.
So, yeah, thank you. There's the slide, I think. So that's how it is.
Taken so much of your time, sir, and I think it's nice to go down memory lane and rekindle old memories. And we could just discuss very few things, but I think they are worth it. I would have loved to have both of you the same platform for an hour or two more. But I think all good things have to come to an end.
It is just like what they say is that travel and learning. Like that how the channels come. Travel. So there's something so much learning is there in traveling itself, and to meet people, different type of examiners, different type of nature persons. So it's lot of things will come up as you grow. Your so-called the narrow-minded look totally changes. That is one thing, is one of the strong points when you talk to people, when you meet people, and when you share people. That's something I have learned definitely in last 20-25 years, some kind of a change in the personality or something like that. Outlook changes. That's what it is.
Every CME, I learned something.
Yeah.
So it is a learning experience also. You go there as faculty, but every time you learn so many things from different people. So I always feel that I am also going for learning.
Yes.
It's an exchange of knowledge, sharing knowledge with students. So the knowledge is the only thing which will increase by donating. So you donate your knowledge, actually you are benefiting, the faculty will benefit. That will increase only. So that is how your teaching ability is improving. So that is what I feel. So it is for learning, it is for sharing knowledge, it is for improving yourself.
It's again such a pleasure, sir, to see two legends who shared more than anyone else in terms of knowledge, and they continue to share. And they're so much willing to share. Anytime you ask them, they are there. One last word by Ishwar, then we'll close.
No, sir. Good evening, and to the great teachers.
Good evening.
And then it is a nice interaction listening from the two great teachers, basically, who have made so much popular among the PG students and postgraduate days to the till today. It is fascinating and very fantastic. And I keep seeing my postgraduate students so fond of your books, both are textbooks. Every time they ask, interacting and asking questions and finding the references with your book, which I'm really grateful to that. You are not only taught the students, you have built the generation of students so they can follow the textbooks. So I really fortunate enough to see both of you doyens of surgical field interacting each other, and making us to understand, making us students to follow your footsteps. Really, it is a nice moment. I never thought that it will go so smoothly. And I thank Dr. Radhakrishnan sir, who is making this possible. And then the next journey, what Radhakrishnan sir is taking all these days since last 6 months, in fact.
my interaction with him is the shortest interaction.
And making learn surgery particularly. Really, thank you once again, sir. You have made these days.
It is my privilege to know all of you and all these.
I wish generations to teachers and other things.
Apart from learning general surgery, if not for learning surgery, I wouldn't have known so many of them so very well. It's my privilege actually. Thank you so much, sir. Thank you, Shenoy sir. Thank you, Babu sir, for spending time. And I'm sure we'll come back again on another day.
Thank you, sir. Thank you, Shenoy sir. Thank you, Babu sir.
Thank you
very
sir.
much.
Thank you, everyone.